Welcome to Not Your Ordinary Parts, a podcast where we talk about hard things associated with the human experience with the goal of increasing awareness, growth, and healing. You may hear information from professionally licensed therapists, life coaches, healers, doctors, etc. This information is not therapy and is not meant to replace actual therapy or instructions given to you by a doctor or a personal therapist. I'm your host, Jelon Johnson. My guest today is Dr. Josh Mirmelli, a Los Angeles-based psychologist who helps his clients in addressing and meaningfully navigating psychological challenges, interpersonal hurdles, and emotional difficulties. Dr. Josh's goal is to help his clients release the joyful parts of themselves that may be hidden underneath painful and traumatic events, betrayal, discrimination and bullying, or even their own abandonment of self. Dr. Josh is an expert on addiction and dependency, fusion and enmeshment, emotional intelligence, motivating interviewing, and mindfulness. So Dr. Josh, welcome to the show. Thank you so much for being my guest.
Thank you so much for having me on, Jelon, and thank you for that beautiful introduction. When you were describing and reading that intro, I was like, oh, goody, who am I going to get to listen to today? And then I realized you're talking about me. So I'm honored to be here, and thank you so much for the incredible work that you do. It's really a joy to be with you today.
Oh, thank you so much. I appreciate that. Received. So I gave a bit of an introduction, but in order for the audience to get to know you a little bit better, could you please tell us about yourself, who you are, and how you got to how and why you are today?
Sure. My name is Dr. Josh Mirmelli. I am a licensed psychologist based out of Los Angeles. I have a private practice here in Beverly Hills, and I work with all different types of folks, individuals, couples, family members, in particular members of the LGBTQIA++ community, and I'm happy to explain the acronym. And my practice includes individuals who are amongst what I refer to as the worried well, to individuals who present with more severe pathologies, ranging from dissociative disorders to post-traumatic stress disorder and conditions to all varieties of mood and anxiety disorders too. I came to this profession myself, a seeker of mental health resources and support. And I really believe that my own experiences in psychotherapy saved my life. From a very early age, I was bullied, brutalized, treated less than because of a uniqueness. I was seen as being different and was marginalized heavily, as I think so many of us are who come to this type of work. And my own journey through grief and heartache and feeling broken, really in that space, I kind of found the will to forge forward. And, I'm a huge proponent of this idea that the toughest experiences make us who we are. And in that space of grief, I really, I had the right support and the right team around me. And I chose to forge forward and heal and make a life and profession out of that choice. So it's really a joy to be with you today.
Wow, that is quite a bio, and I believe that, like you said, the things that you've had to go through and endure and survive would make you so much more of a listener and someone who can relate to your clients. So thank you for doing the work that you did to get here.
My pleasure. Thank you.
So you help your clients in addressing and meaningfully navigating psychological challenges, interpersonal hurdles, and emotional difficulties. Can you describe sort of the way you do that and what that looks like?
I can try. I say there's kind of a technicality, there's a science to what we do as clinicians and providers, and then there's sort of this like art to what we do, this more mystical, sort of soulful human experience that takes place that's hard to kind of put into words, which is ironic since so much of the work I do involves listening and talking and engagement. But really my hope is to uncover, as you described in my bio, those parts of ourselves that we abandon, we hide away out of fear that they'll be mistreated or in some way judged or devalued, and to uncover those parts and to kind of repurpose them in a way that forges identity. I think so many of us are born into the world really knowing who we are, and the trauma, the brutalities that we receive really create some blurriness, and we lose sight of that. So it's kind of this journey of finding our way back to ourselves. But I believe that for most of us, we intuitively know what we need. We intuitively know what we want. The I don't knows that I frequently will have as replies when I ask people in session what it is that they believe themselves capable of achieving. I will challenge, and I will say things like, I want you to pretend like you do know, act as if you do know, and give me the first answer that comes to mind. Because I think many of us intrinsically know what we need to do for ourselves. Otherwise, people would likely not be sitting across from me in my office. So my hope is to always empower individuals to become the own experts in their lives and the own sort of platforms of their healing and growth. I'm a conduit to that healing and growth, but I don't know the path and I don't know the next step as much as anybody who walks through my office. It's a little secret, right? I have no idea what the heck we're doing, but let's get there together.
Wow, I like that. And I think that being able to see the human side of a clinician a lot of times makes them much more relatable. And so for you to say, I'm here with you, I have these skills, but we got to figure it out together. That's powerful. Mm-hmm. Really powerful.
I think so too.
So there was something in your bio that I wanted to touch on a bit, right? Because there's a part of your practice that involves helping your clients to release the joyful part of themselves that may be hidden underneath painful and traumatic events, betrayal, discrimination, and bullying, or even abandoning themselves. Can we touch on that a little bit?
Yeah. I mean, I, as a kid, loved to sing, and I lost my voice, actually, lost my singing voice around the time that I started being severely bullied. And there's this physiologic component to suffering that I think is cellular, that we feel on a core level. We betray often in an effort to align with our perpetrators and to make the suffering stop. We kind of align with them and we self-betray. And so much of my own healing and the work that I do involves getting back that voice, that singing voice. I mean, it could be literal, it could be maybe more metaphorical, but that voice that can sort of experience joy and liberty and spontaneity. And I think we become very restricted and very rigid and roboticized in our functioning, especially men. We, come very militant and sort of soldierized in the way that we engage interpersonally because we sort of develop these scripts. And I really, my hope is to help people reestablish their footing because, again, I don't know that I do very much other than erase some of the shit that blocks us from our core, from who we are. And by erase, I don't mean take away, but I mean do the work to confront the obstacles where they no longer hold so much power.
Wow, I love that. And being able to pinpoint the moment when you lost your singing voice and the reason why, I think that's powerful because it can help others to understand, okay, I may have at this point, without knowing it, betrayed myself because of what I was going through by, the perpetrator, like you mentioned. So I appreciate you mentioning that.
That's exactly right.
Okay, so I think that what we were touching on, especially the way you described for men, the scripts that we follow, it's difficult because we may not truly understand what's happening or why we're doing the things that we're doing, but we get out of touch with our inner selves and our emotions. How How can someone learn to experience and be present with all of their emotions is my first question.
Mm-hmm. It's a good question, and I don't have an answer that is, I think, so neatly packaged. I mean, if I did, I would be, raking it in. But in a nutshell, I mean, I think learning to sit with and be present with all of our emotions. Most of us don't really know. I have this handout, just to back up for a second, that I'll give most of my new patients in my practice that involves like 40 different emotions. And one of the feedback pieces that I get is, holy shit, I didn't know that there were that many like feelings. And most of us are restricted to like this mad, glad, sad, scared connection with emotion. We don't really know that there's much more beyond that. And for men, I think we'll sort of stick with this, mad, glad. The sad and scared, absolutely not. We don't want anything to do with those. But to be able to sit with and attune to all of our emotional experiences, the good, the bad, the ugly, the painful, the grief-stricken, that will enable us to fully and wholeheartedly experience the good stuff, the joy. Brene Brown, a brilliant researcher and, voice of modern mental health and kind of creating a great access point to the masses for mental health resourcing and understanding, says we cannot selectively numb emotion. And that's so true. To experience the joy, to experience the lust, to experience the wonder that makes us tick as human beings, the intimacy, the passion, the exhilaration. We have to experience the fear, the dread, the shame, the guilt, the grief. And I know of no other way to sit with any other emotion than to be in the muck with it, to feel it, because that's what feelings want and demand from us, is the feeling. Sit with me, hold my hand, stay with me. Feelings are very much like that inner child within us that we betray. We learn to kind of betray, along with the bullies in our lives, whether figures, people, thoughts, ideas, all different types of social, prejudicial, racial discrimination. We betray self. And feelings, no differently, really want to be sat with.
Wow. That was an amazing explanation. And I love the way you mentioned the fact that we can't pick and choose which emotions we feel. I mean, if we could,
No.
life would be great. But in order to
Right.
get to where you want to go, you're going to have to go through some of the uncomfortable emotions. On the other side of pain is joy a lot of times. And in order to get there, we have to sit in that pain to understand and comprehend what it is it's trying to tell us and what it is we need to do. So thank you for that explanation.
Yeah, I have a colleague who says we've got to have the clouds to get the candy. And what I think he means is, I mean, he could be meaning something entirely different, but what I extrapolate from it is we've got to sit with all of it.
Right.
There's no shorting the sensation of feeling an emotion.
Right. And you talked about self-betrayal a bit. And when we betray ourselves, we can also have a tendency to neglect who we truly are. So my next question is, what is self-neglect?
Mm-hmm. I think it's the practice of putting ourselves last, the partitioning of a space that's intended for us as being such a minor fraction of time spent invested in our daily doing. It's when we become human doings rather than human beings. We're so caught up in the rat race, acting, performing, going through this motion, this conveyor belt. We've got the same goals and the same resolutions in 2023 that we did in 2013, 2003. How did we get here? We kind of laugh off this abandonment of self, haha, but it's not funny. And what starts to happen is that we really feel like we've betrayed our wishes, our hopes, our aspirations. And in fact, we have. It involves no longer taking ourselves seriously, minimizing that voice inside of us that believes we can do more, be more, reach our fullest potential. We have, in fact, decided to give up when we self-betray. And maybe we'll say that there's something adaptive about accepting circumstances as they are. But I think there's a very big difference between acceptance and concession, right? Conceding to circumstances that no longer serve us well, staying in that non-nurturing relationship because we don't believe in our abilities to get out of it, because we treat ourselves just as bad as that bully or abusive spouse. So self-neglect in a nutshell involves no longer putting ourselves on our to-do list. And I think for a lot of us, especially working parents, those of us who are working multiple jobs, who are just trying to survive, we lose a sense of what it means to really live. And I encourage folks to reserve some space. I don't care if it's 20 minutes a month for listening to that language of liberation within ourselves. What is it that produces joy, emancipation from this 9-to-5 humdrum of existing? We don't want to exist. I don't think I was put on this planet to exist. I want to live. And we forget that. We silence it because it's a threat. It's a threat to the status quo. It doesn't serve us well, we think, to have ambition anymore. And my work with folks is to bring back that voice. You know, I'm Jewish, and I don't know if it's like a Yiddish word, but there's this term called chutzpah, like somebody who has the chutzpah to kind of push against the current that is the status quo and the norm for the sake, in this case, of something deeper, something bigger, something more, something better. And I inspire, I hope, in some sense, my goal is to, I should say, inspire the chutzpah in people who've kind of conceded to convention.
Well, I don't know if I have conceded to convention, but I hope I'm saying it right. You've inspired the chutzpah in me just from listening to you say that, because that was so deep and profound. My God. Thank you so much for that explanation. Oof, man.
You got it.
Okay. I'm excited to see how you answer this question, right? In your opinion, why are shame and guilt so difficult to deal with while someone is on their healing journey?
I look at them as very unique emotions. I think we conflate them sometimes. Guilt is a sense of I did wrong. And guilt actually, I think, is a very constructive emotion. It's one of the foundational building blocks to what Sigmund Freud would have referred to as the superego, the part of ourselves that kind of moderates behavior. So guilt is, gosh, I felt really badly when I stole $10 from, my parent or partner or colleague or boss. It moderates our behavior. We don't do it again. Shame is, it's an interesting one because I'm going to kind of go against what I said earlier in that emotions are meant to be felt. Shame is that one emotion that I say, let's give it a little bit of space, but not too much, because shame is this idea of I am bad. I am wrong. I am a screw up. I don't know how much space there is for that in a functional way, because I don't think it really leads to anything productive or inspiring of change. It's too encompassing and too engrossing a sensation that it doesn't really give us the emotional space and freedom to actually evolve from. So guilt is productive. I think shame in some senses is destructive, in that it inhibits growth and change because we feel too bad. We feel too broken. And I don't think we are. I mean, really, I don't think we are. I think we all make a series of choices Some of those choices lead to outcomes that we wished were different. But shame inhibits the capacity in us to rethink those choices. And it instead tells us that we're not worthy of rethinking those choices. We're too much of a screw up. Guilt is inspiring of changing our choices. And to me, that's where real work and resolution, both in therapy and in life, stems from. I hope that was helpful in differentiating.
That was both helpful and differentiating. Thank you so much for that. I don't know if a lot of people, or even speaking personally, can differentiate between the two. I think that for me, shame and guilt have always been one and the same, but to be able to hear that there is a spectrum between the two and that you don't have to feel one because of the other, that's for sure helpful. For sure. So thank you for that.
You're welcome.
Okay, so next question. One of your posts said, if it's not yours, don't pick it up. What does that mean exactly?
Wow. It means a few things. I mean, it's kind of like at the airport. I was just traveling over the holidays and there were like signs everywhere, like, if it's not your baggage, don't collect it. And I'm thinking, wow, are they talking about my suitcase? Or are they talking about something deeper? I think they were talking about our suitcases because it was in the baggage claim. But we tend in our relationships, especially, to attempt to pick up material, to resolve material that doesn't really either need to be fixed or is not for us to change and fix. And this is kind of the difference between helpful helping and maybe like enmeshment or enabling, and I think what happens is when we pick up material that doesn't belong to us, what we're ultimately doing is we're protecting somebody or inhibiting somebody from experiencing the natural consequences of their behavior that may inspire them to change if they were to receive. So we kind of like blockade people from being able to experience those natural outcomes of poor decision making, right? Or decision making that is destructive in some sense. So how do we know what's ours? How do we know what's not ours? I think the real question is what is motivating our decision to pick something up? Are we feeling threatened? Are we feeling scared? Are we feeling as though our role is in question? If the answer to that question is yes, those questions is yes, what I encourage is folks to pause, to really pause before picking something up. I am a huge proponent of psychotherapy for everyone. And I also don't think that change and, personal discovery and self-growth is exclusive to what takes place in the office of a professional, licensed clinician. I think that we can pursue healing and growth in all different iterations and forms, whether it's in religion, spirituality, or self-help or professional work. And so being able to distinguish what belongs to us and what may not, I think comes from that journey of self-discovery, so we can really know, what's a trigger point for us. If it's triggering to me, does that encourage me to take care of something that is not for me to pick up or care for, but it belongs to another person? And I think commonly the answer is yes.
So listening to your explanation of that, which was wonderful, it made me think of codependency, right? And that was a term I was unfamiliar with for so long because I just thought it was normal to pick up things that didn't belong to me because it was a way of me showing others that I cared, that I loved them, or, all the things. Can you touch on what codependency is briefly?
I think you said it really well. It's doing for others what others can do for themselves. And look, I think you described earlier before the show started that you're a parent. I'm a parent myself. It's wired within our DNA as human beings to have some codependency. When my, now 11-month-old son is, tantruming, is screaming, is not able to get to sleep, I don't walk into his nursery and say, that's your stuff, resolve, that would be not, I mean, I could say that. I don't think he'd get it. I don't think it would do very well for his sense of secure attachment. You might have a different guest on your show today if that was my approach, but we have in us this innate impulse to fix, to caretake. And I think in certain contexts that really works well. What happens for those of us who are encountering less than nurturing experiences, which is my working definition of what trauma is. Simply, it's a less than nurturing experience. It doesn't have to be the rapes and, gunshot wounds that we assume is associated with trauma. It can be anything that doesn't resonate with what feels safe for us. When we have those experiences, there's a cross-wiring that takes place where we lose sight of what it is to caretake, to care for, and to sort of show up in ways that not only aren't helpful, but can sometimes be destructive. So I think we have to really ask ourselves this question of, am I doing something for another person that they can either do for themselves or that they would benefit in some way from not having done, and learning the skills, tools, resources to be able to achieve that outcome, themselves, of resolution or of fulfillment or of need fulfillment. And if we're doing that, I think we really have to take a look at why that is. Do we feel not deserving of love otherwise? Do we feel like we have to earn our keep in order to be securely attached? These are important questions that may inspire our understanding of why we do what we do in our relationships.
Wow. Thank you for that again. That was a wonderful explanation. And I think that when, because if you're on social media, you hear these therapy buzzwords and you may get, a kind of an explanation or a definition of something based on what's popular. But
Sure.
To hear it explained so well, like you just did, and because of who you are, I think it carries more weight, and we can now say, okay, well, now I understand what codependency is, or now I understand what it means, to become unenmeshed. So the way that you explain it, and your background and your experience, it does help. It's very helpful in learning what it is and not just having to lean on, TikTok or Instagram or just, whatever is popular right now. So thank you for that.
You're welcome. And that's a good point, because I think that there's a lot of social media that's really wonderful for mental health awareness. There really is. And I don't think you've got to be a licensed psychotherapist or psychologist to offer useful information about different mental health topics. But there's also a popularizing of words like, gaslighting or codependency, enmeshment, or narcissistic abuse. These are kind of like big, like pop cultural, buzzy mental health topics that I think ultimately water down the significance, because the truth is that clinical narcissists represent a little bit less than 1% of our population. And according to TikTok, we've encountered 73 within the last hour. So I think we really have to be mindful of what are patterns within relationships that feel a bit icky and non-nurturing and important to address versus those that are really meriting a diagnosis of a mental health condition. And so I think that we've got to have sensitivity, because in the overpopularizing, there can be a watering down that takes place, and therefore difficulty in distinguishing what mental illness is and is not.
I agree. And a lot of times we may not want to take accountability for something that doesn't feel good. So the person who is trying to hold us accountable, we may say, oh, well, that person's a narcissist or they're gaslighting me. So we can pick and choose
Yes.
when it's, when we want to use those terms to avoid having to be accountable and deflect what's really going on.
100%. I had to ask myself the same question. I said, why does my husband, according to myself, have 72 different mental health diagnoses? And then I realized, probably because I'm unhappy with some of the decisions and I didn't like his no. So yeah, I think that's really valid.
I agree 100%. So dealing with all the things that we've discussed so far and just having to live in the society that we live in today and just going through COVID and, it's a lot and a lot of us can become tired. So my next question is, what is mental fatigue?
It's the product of not prioritizing ourselves, of feeling devalued unless we do, of feeling like there's a script for performance and the duties of what it means to be a partner, a caretaker, a parent, a supportive child and loved one. It's when we lose a sense of that connection to those 20 minutes a week of nurturing that inner spirit in us that wants to be exhumed, freed from the status quo of expectation and role definition. So I always tell people, if at the end of each day you're feeling more recharged than you are at the beginning of every day, that's probably an indicator that you're not prioritizing self-care enough. Because what that tells me is that only when all of your to-dos have been crossed off the list, that's when you're kind of able to nurture downtime. There's this compensatory insomnia that I'm hearing more and more about, how people are staying up later to kind of win back the day because they've done for everybody else other than themselves. So people are feeling like, well, screw it, I'm going to stay up till 4 a.m. Obviously, that's not functional in terms of, getting good rest. So if you're feeling like it's only at the wee end of every day that you're able to take in some breaths, that's problematic. A way to rehearse the prioritization of self-care is to put a little alarm clock on your phone for the last 5 minutes of every hour. And during those last 5 minutes of every hour, to really just focus on your breath, noticing the movements in your body when you inhale through your nose and hold that breath, the movement through your body when you exhale through your mouth and hold that breath. So I try to work very sensorially, getting folks to engage their 5 senses as a vehicle to really determine where our bodies are, how we're feeling, what the temperature is, what we're smelling, what we can touch, what we can see, what we can hear, what we can taste. That's really important as a vehicle to offset this roboticizing that has taken place, I think, in modern times in terms of self-neglect, really.
That was a great explanation again, and a lot of good advice too. Setting an alarm at the end of every, for 5 minutes at the end of every hour. And even, it's funny how we think we're getting healthier by doing things like staying up later, but it's very unhealthy, and it doesn't address the main issue, which is the fact that we're not prioritizing ourselves, and we're people pleasing essentially because we're putting everybody else before us, and then taking time away from where we should be getting rest by saying, okay, now that the end of the day is over, let me stay up for an extra 4 hours to give myself some time.
Right. That's exactly right.
Also, I'm stealing sensorially because I like that one.
Great. Steal away.
Okay. Another one of your posts said, that to which is unspoken cannot be heard. And that seems simple, but I'm sure there's a good amount of depth to that. Can you explain that for me?
I have a patient I'll never forget who said to me, My husband's not respecting my boundaries. I said, oh, I'm so happy to hear that you've set some boundaries. She said, well, I didn't set them, but he's violating them. And what that told me is that we have an expectation sometimes that others can mind read. And while I hold space for those who are mind readers, I'm not one. And I tried my best to not assume that the people in my life are. And if they are, I'll be pleasantly surprised. Half the time I don't want them to mind read, but the good stuff, okay. But we need to be more explicit. We deserve, I should say, to be more explicit with what our needs are. So if we have a boundary that's being violated, I think the first question to ask ourselves is, what limit did I set? What consequence did I give? And really quickly, I'll just say we have this misunderstanding that a boundary is about changing another person's behavior. Well, unlike Siegfried and Roy, I'm not a magician. So I can't change another person's behavior. I can hold limits for what I'll tolerate and accept, and I can give consequences for when those acceptances and tolerations are violated in some way, but I cannot change another person's behavior. So when I set a boundary, what I'm saying is, when you do this, that makes me feel this way. And in the future, I'm not going to accept that. And so moving forward, when that happens, here's what I'm going to do to protect myself. If you push past it, here's what I'm going to do to protect myself then, right? It doesn't mean I'm asking the person, notice, to stop the behavior. I'm not saying don't do that. I don't have control over that. But we're in this land, I think, where we are very keen on negotiating. We negotiate our salaries. We negotiate our business practices. We negotiate our needs. One area I never want for folks to negotiate is their own self-worth. But that requires us to really take a look at what limits we're engaging in to protect how worthy we are, how much worth we assign to ourselves. So that to which is unspoken cannot be heard really references the importance in establishing clarity and an explicit tone to examining for others and ourselves what our needs are and what boundaries we'll engage in to protect those needs and rights. And that differs from one person to another.
Well, again, that was so well spoken and well stated, and I think it just makes it so easy to understand. Like, for instance, if someone like your client who came to you and said my boundaries are being violated, but she never spoke up about them. So you can't expect someone to respect a boundary if you don't state what it is, but also knowing how to set a boundary.
Yes.
So thank you for that explanation. That was very good.
My pleasure.
So all the things that we're discussing, codependency, boundaries, self-neglect, these can all be a byproduct of a dysfunctional family, possibly, or just dysfunction in general. But to kind of hone in on the family, I've seen that there are 4 family roles that you discuss, right? And one is the hero, the mascot, the scapegoat, and the lost child. Can we kind of dive into those?
Yes. So there's some additional roles, but the 4 primary ones that you're talking about are correct. The hero, the scapegoat, the lost child, and the clown or the mascot. So the hero, and I'll talk about them in terms of what things look like on the outside and then what things are experienced like internally. For the hero, there's a sense of perfection. They're always right. They receive a high amount of praise, positive affirmation, but internally, there's immense fear of letting others down and screwing up. There also may be a sense of fearing being over-controlled, and like that person is not able to make their own autonomous decisions. For the scapegoat, they're kind of the opposite of the hero. They're the black sheep of the family system. They're the outcasts. They can be impulsive, angry. Internally, they're filled with shame, hurt, rejection, and there's little motivation to succeed because she or he or they already feel like a loser and a failure. So there's not really a script or landing for them to alter behavior. The lost child externally is often ignored, quiet. There's a feeling of real invisibility. There may be a low sense of self, identity, and worth. They're not really pushed hard or encouraged to succeed. Internally, these are individuals with what I refer to as frozen feelings, resulting from never really feeling a sense of value, never having feelings that were valued. They may feel alone and misunderstood. And then finally, the mascot or clown of the family is externally presenting as being funny, goofy, immature, doing anything for a quick laugh. Internally, they may hide their pain with humor. They feel inadequate, and they're seldom taken seriously or really respected or valued. And I think psychotherapeutically, the work is to soften some of the tone of intensity within these roles and to look at what's also working, because there's adaptation in these role assumptions too. These may have been roles we assumed to survive.
Wow. I don't think that in or around or associated with dysfunction or a dysfunctional family, or just, family dynamics, if you've experienced these things, you're able to step out and identify what they are, or maybe what role you play. So for a lot of us who come from, dysfunctional families, or just circumstances that didn't allow for emotional health and well-being, having a
Right.
name for what may have happened or what role you may have been playing in your family is like mind-blowing.
Yeah. We name it, we tame it.
Exactly. I just finished for the second time Adult Children of Emotionally Immature Parents.
Wow.
And it's such an incredible book. It really is. And it gives so much light to all of the things that a lot of us went through but didn't know we were going through. And also you can give grace to a caregiver or a sibling that may have been a part of that family dynamic and wasn't aware of what they were doing.
That's right.
And it allows you to become, unenmeshed from those feelings and just see them for what they are. So.
You're right. Because I believe most of us are doing the best we can with the skills we've got. But if the only tool we have is a hammer, there's going to be a lot of holes in the wall, right?
Exactly. So I wanted to ask one other question,
Sure.
which is when someone decides to start their mental health healing journey, there is undoubtedly going to be a lot of things, right? There's going to be a need for support. There's going to be some uncomfortable feelings. But when they are able to get the courage to, call someone or sit on that couch for the first time or have a telehealth interview, what is the difference between healthy support and codependent enmeshment?
Mm-hmm. Are you referring to within the context of professional counseling, like in that sphere, how to know
Correct.
what's okay? I think that's a great question. I don't tend to hand my patients tissues when they're crying. And I once had a patient say to me, quite literally, and by the way, I'm still working with this patient many years. So this is them talking to me. Are you not seeing that I'm crying right now? Me talking. Mm-hmm. Yes, I'm seeing that you're in a lot of pain and you're crying. Okay, why didn't you hand me a tissue? Profound question, right? Profound question. If I handed that person a tissue in the midst of their tears, what I might be telling that person is to stop crying, right? Not a validation of their feelings. So we worked through it. It was valuable. material for psychotherapy. If you're feeling as though your therapist is minimizing, inhibiting, shorting you from having the space to experience whatever you need to experience. In other words, if you're feeling like there's any element that's non-nurturing and there isn't the space to be able to openly navigate that, and maybe even some shaming that takes place, get another therapist, right? I like what you said, interviewing. And I think in the same way that we sort of date before we get married, hopefully, right? I mean, some people don't. In certain cultures, arranged marriages, but like, let's not treat psychotherapy like an arranged marriage. We ought to do some interviewing, speak to a number of different people, ask about what their practices are, how they measure therapeutic success, what termination looks like. And these are questions that I think a skillful clinician who's capable of holding space will be able to comfortably and confidently answer. And also trust your own intuition. Even though licensed clinicians, practitioners in the mental health field may be experts in the profession, you are the only expert in your own life. And never forget that, right? It doesn't mean having all the answers, but I will never be an expert in the life of Jalon Johnson. Only you can be. And as soon as you find that I'm experting your life, narrating your story, fire me immediately, please. Because that's not effective work.
That was also very, very great and an explanation. And I think that a lot of people don't feel empowered enough to be able to say, well, I'm going to interview a couple of therapists. It may be, well, this person was willing to take me, so I'm just going to sit with them, and they may sit through therapy and be uncomfortable or not really understand that therapy is about their healing and not what about the therapist says so much.
Yes, exactly.
Okay, so final question, and I usually close with this. If you could use your platform to encourage someone who may be struggling with going to see a therapist or talking to someone about their big feelings and emotions, what would you say?
I would say never give up. Whether it's in finding the right level of support, there are all different types of clinicians, providers, helpers, healers. Don't give up on that journey. A great platform that I encourage folks to use, and there's no I'm not sponsored by them, but I like psychologytoday.com because I think that it provides a nice landscape of a variety of different providers. You can filter by insurance, by price, by area of specialization, really take the time in investigating what feels intuitively right and feel comfortable, ask questions and really come to resonance with this truth that you are your own expert. It doesn't mean that you have all the answers. No one does. But trust your intuition. That would be my big ticket recommendation.
That was great. Thank you so much. And also, thank you for your time and your expertise, what you do, the way you do it, how willing to be vulnerable you are and sharing your experience and just how you got to where you are today. I think this was a very, very powerful interview. I was able to benefit from it, and I hope that anyone who listens to it will also feel the same way.
Thank you, Jalon. It was an honor being here, and thank you for all of the incredible work that you do.
I really appreciate that. So if someone wanted to find you online or on social media, where can they find you?
You can look me up on Instagram, YouTube, Meta, at Therapy with Dr. Josh. That's Therapy with DRJOSH. You can also find me on the web at therapywithdrjosh.com.
Okay, great. Well, again, Dr. Josh, thank you so much. This has been wonderful, and I enjoyed sharing this space with you, and I just want to thank you again.
It's been a joy and pleasure. Thank you, Jalon.